এখন এটা অন করুন।
হ্যালো, হ্যালো,
রুবা ভাইয়া,
হ্যাঁ আপনি শুনতে পাচ্ছেন? আমি এতক্ষণ ধরে কারো কথাই শুনতে পাচ্ছিলাম না।
না না আমি তো এটা অফ করে রাখছিলাম ভাইয়া। স্বাধীনকে বলছি বা মামুন ভাইকে একটু লাইভ করতে প্রোগ্রামটা, কারণ ওই যে গেস্টরা নাকি ঢুকতে পারছে না।
আমি তো এখানে দেখতেছি খায়রুল আল মামুন লাইভে ইয়ে করা,
আপু অলরেডি লাইভ করা হয়েছে।
লাইভ করা হয়েছে।
আচ্ছা
আচ্ছা এক মিনিট, এটা যদি লাইভ করা হয় দয়া করে যারা আমরা পকপক করতেছি পকপকানে বন্ধ দেন। আপনারা দেবীতে আগে বলছিল ইন্টারনাল মেসেজ টেক্সট, আমাদের যে টেক্সট আছে এখানে টেক্সট দিবেন, ওখানে কথা বলেন, কারণ লাইভে আমরা কথা বলতে পারবো না, শুধু হোস্ট আর প্রেজেন্টাররা কথা বলবে। সো ইফ ইট ইজ লাইভ উই শুড কন্ট্রোল আওয়ার লিড। বাই।
ওকে ভাইয়া।
According to the chat option, like already participate in our program from the left.
Okay, Saurabh, did Appa join to us?
I yet not
Hello.
saw her. I yet not saw her.
Yes, I didn't see her yet.
I don't know what happened. No, none of the guests yet to actually.
I would like to keep patience to every participant. We had some trouble in technology. We will soon reconnect. Please keep patience and be with us.
Saurabh there. Are you listening to me?
Yes, I'm listening to you.
I think we should start. I think we should start.
We can start the meeting. I think so. Ryan,
Okay,
bhai,
Saurabh,
please start the
can I
meeting.
start? Okay, thank you. Hello, everyone. I would like to apologize first for our inconvenience that happened to technology trouble. Can all of you listen to me? Hello,
Yes,
everyone.
Yes.
Okay, thank you. Okay. I would like to welcome all of you to the online workshop of child protection in the context of COVID-19. I wish all of you are safe and well during the pandemic. Now, I like to introduce myself at first. I am Rubai Raihan, working at DRRA as Advocacy Manager. This is my short description. I would like to share some instruction for all of you to execute the online workshop successfully. Please keep your camera and microphone off or silent or mute. During the period of your discussion, you need to open or turn on your camera and microphone. Let's every one of us turn off our camera and silent our microphone. Shaim bhai, we can turn off our microphones so that everyone can listen clear. Okay. Another point I want to add and inform to all of you that if anyone feel to provide any necessary information during the panel discussion, please note down your point and discuss your point during the second part, that is the discussion part of one-line work. And please then hand raise from your side. Actually, the meeting is divided in two major sections. First, we will listen the discussions of panel guests, panel discussions, and then we will involve in open discussions. I want to brief about the agendas of today. In this meeting, we will listen discussion on child safeguarding practices for inclusion of disability, and then listen field experience on the country context of Bangladesh and also from the Liriani Foundation. Then we will listen about the situation of child protection in COVID responses and national initiatives of child protection and disability inclusion. Then the second part of the discussion will be started. Here, at first, partner organizations of DRRA will discuss at first, and then we join in the open discussion. I would like to introduce today's panel discussions at now. At first, I would like to introduce Mr. Khandokar J. Alam. He is the Executive Director of CSID. He will discuss on experience from field on disability inclusion and child protection during pandemic. Then I would like to introduce you Mr. Ashim Dio. He is the Advocacy and Communication Manager and Safeguarding Focal Person from CVM. He will enlighten us about safeguarding first for disability inclusion. Right after him, Mr. Saurabh Kumar Pal, Manager of Red Department of DRRA, will present study finding on child protection during COVID-19 pandemic. Then Ms. Glory Shiar, the country experience of Africa region. Here, I would like to introduce Mrs. Leki Van Lameren from Liliani Foundation. She is the advisor of our organization and will discuss about the experiences of Liliani Foundation on child protection considering COVID-19. Then Mrs. Sharmin Khan, legal advisor, ICNL, will present discussion on COVID protection matter and national initiatives of child protection and disability inclusion. Right after her discussion, as the final discussion, Ms. Flora Jasmine Dipa, Program Officer UNICEF, will present a discussion on situation of child protection in COVID-19 perspective. Here, I want to mention to all the discussions that please be aware about your timing and duration of discussion. We are requesting you to maintain your time duration. Now, I would like to introduce today's meeting's moderator, Ms. Farida Yasmin, the Executive Director and Founder of DRRA. She has been working for persons with disability for last 25 years in Bangladesh. She received numerous national and international prestigious awards for her amazing contribution. She is also involved with numbers of organizations and government bodies. Currently, she is working with 200 DPOs and 30 NGOs network. Now, I would like to request Ms. Farida Yasmin to take over the charges of moderator of this meeting and explain precisely the objectives of the online workshop. Thank you. Dear Faridaba, can you listen to me?
Hi, sorry, I don't even see Foidappa in the participant, within the participant list.
So how we will proceed to the next situation? Should we start the discussion? Shamim Bhai, Saurabh and Deveshda, should we start the discussion part?
According to the information, somewhat all of the participants are trying to participate. Therefore, they are trying to participate by involving the password and username. Therefore, I would like to request all of you to wait for some time more.
Okay, thank you. We are waiting.
Saurabh. Hello. Hello, Saurabh. Are you listening to me?
Appa, we're all, I don't know about the rest, but I can listen to you.
Welcome, Sharminappa. Nice to see you here.
And nice to hear you, Jamal. Malvasan.
At the end, someone from outside has been attended. Actually, we are facing trouble.
I've been listening to all of you since the beginning. I'm just waiting.
Thank you, Appa. I can't see you. That's why. Our Liliana Foundation also facing trouble to attend. They have sent a message to me through Skype. I don't know why. I'm trying.
No.
Dada.
Reason I'm telling you, people are.
Huh?
Okay, I think. Hello.
Hello.
Hi. Hello. At least we have someone online.
Hello. I would like to request you to keep patience for time as we are facing some trouble in online. So we will start after joining of everyone.
It's good that Sharminapa is here. So if Alumbai and others joining, then we can start. Lilian Foundation facing travel also from Cameroon. One of the participants from our SPO, she is also struggling. I'm trying to connect them.
Jamal, I guess someone else. I'm not sure. Like, there are other people also join. I can see.
Yes, but the speaker, that is who are the presenter like you, we are missing all them actually. So the panelist,
Right.
that is presenter, needs to be
No
attended
worries.
first.
Right.
You can start.
Sure.
Yeah, we are happy that you are at least attended.
Please keep your microphone off so that we can hear everyone clear. Okay, I think Foidapa joined to us. Foidapa, could you hear to me?
Hello.
Hello, Appa. Yes, we are listening to you.
Okay. Actually, I could not see who are the outsider of the DRRA team because
Apa Elif just attended. EK just confirm me. She has attended. She's just confirmed.
the most important is if any link is not working, please resend the link. Sometimes it's happened. So somebody just busy to resend the link.
Yes, I've sent already to her and she has attended.
Yeah, sometimes there is a two link. One link for installation of the software, another is for the talking. So that's it. Should not send it at the same time. So anyway, আলম ভাই কি জয়েন করতে পেরেছে?
He's struggling. Maybe he cannot join yet.
আলম ভাই অনেকক্ষণ থেকে চেষ্টা করছে. I feel so bad. He couldn't join.
Yes.
Assalamualaikum apa, আমি শারমিন, আমি জয়েন
I'm
করেছি।
here.
Okay, thank you, Appa.
I'm here. This is Ika.
Hi,
Okay,
Ika.
yeah.
Glad that you can join. Actually, we are very familiar with the team, but today what had happened, we don't know. At least 2-3 speakers, they are in a panel, they're struggling since long, but they couldn't. Mamun, you just send a newly link to Alim Bhai and Osimda so he can get. I was getting problem. My problem was belongs with Apple. When I change the Apple computer, I get access. So I don't know, maybe. Jamal, what is about our partners? Do they successfully able to attend?
Yes, Appa. Our most of the partner has been attended. DDRC, PCC, and Asha Foundation. I've seen them. So that's also
Okay.
trying. So more than 4 partner I already attended.
Okay.
8 ফাউন্ডেশন থেকে আছে জামাল ভাই?
Yes, 8 Foundation also.
এই
Yeah.
আপনারা যারা আছেন সবাই একটু বাংলায় আমাদের বাংলা বা ইংরেজিতে একটু ইন্ট্রোডাকশনটা শুরু করি তো তাহলে আমরা বুঝতে পারবো যে আমরা শুরু করার জন্য কাউকে
শুভদীপুর আপা, আমি সোয়া পারভিন শিল্পী, 8 ফাউন্ডেশন ঝিনাইদহ।
ওকে, থ্যাংক ইউ শিল্পী। দেন নেক্সট
আপা রাজন বলছি, প্রতিবন্ধী কমিউনিটি সেন্টার মাইমেনসিং থেকে।
পিসিসি থেকে। ওকে, থ্যাংক ইউ রাজন। হাউ আর ইউ?
I am fine, আপা।
And Shilpi, how are you? What is your COVID situation? Hope you are doing well.
হ্যাঁ আপা, আমরা ভালো আছি। আমাদের এখানে কোভিড সিচুয়েশনটা মানে এখন অনেক বেশি রোগী পাওয়া যাচ্ছে, তবে আমরা সুস্থ আছি। আমাদের কমিটি, আমাদের বেনিফিশিয়ারিজটাও সুস্থ আছে।
Okay, thank you. So, from Basta Shekhar, somebody is there?
আসসালামু আলাইকুম, আমি রাসেল আশরাফ ফাউন্ডেশন যশোর।
Hi Rasil, how are you?
ফাইন আপা।
Okay, thank you.
Most welcome.
And then, okay, next.
DDRC. Okay. They can hear maybe.
ওই অনেক সময় মাইক বন্ধ করে রেখে কথা বলা শুরু করে।
Yes, that's the problem.
Sometimes that
but
is
I've seen DDRC also.
আমি অলরেডি যে 16 জন পার্টিসিপেট করেছে তাদের নাম বলি, মনে হয় আমি পার্টিসিপেন্ট লিস্ট থেকে দেখতে পাচ্ছি।
না, আমিও দেখতে পাচ্ছি। আমি চাচ্ছিলাম যে আমরা পরিচিত হয়ে যাই।
দেখেন আপা চাচ্ছিল একটু কথা বলতে।
চাচ্ছিলাম যে পার্টনাররা যারা এসেছে তারা আগে আমাদের সাথে একটু পরিচিত হয়ে পরে when we start in English, that could be a little difficult for them sometimes. So let me start with our partner first, and gradually when the speakers are here, we will join. So we among 25, already 16-17 we already joined.
Abo model to
Please keep your microphone off. আপনারা আপনাদের সবার মাইক্রোফোন গুলো একটু অফ রাখবেন, যখন আমরা কথা বলবো তখন মাইক্রোফোন অন করে কথা বলবো। আমরা সবাই একটু আমাদের সবার মাইক্রোফোন
From the central control, I mute all. Please, who are speaking, open your mic, please. Who are speaking, please open your mic. Who are speaking, please open your mic. All of the mic are muted now.
we all will keep our microphone off during our discussion, only then we will open our microphone. Okay.
Proceed our self-introduction. So those who are here, please now please continue one by one, either DRRA and outside member, so we can really know each other, the who are here. When you talk, you just open your mic and then talk.
Good afternoon, everyone. This is Saurabh Kumar Paul from DRA. I'm working with DRA more than 5 years, and I'm working here as a departmental head of RED department, Research Evaluation and Data department. Thank you from my side.
Thank you, Saurabh Kumar Pal. Thank you for your nice introduction. I am Rubai Raihan. I am working as Advocacy Manager in DRRA. Here is my short introduction. I would like to request Mr. ABM Shamim Ahmed to provide your introduction.
Hi, good afternoon. Myself Shamim Ahmed. I am working as Program Manager in DRRA, implementing Inclusive Disaster Risk Management project in Shatkhira district. Thank you.
Thank you, Mr. Shamim Ahmed. I would like to present a short introduction to 8 Foundation. From 8 Foundation who have been joined, please provide your short introduction.
Hello everybody, I'm Shreya Parvin Shilpi. I'm program focal. I'm working in Jhinai district. My organization name is 8 Foundation. Thank you.
Thank you. Thank you. Mr. Amir Hussain, please provide your short introduction. Mr. Amir Hussain, do you hear to me?
Okay, go for next.
Okay, next. From Ashraf Foundation who have been joined, please provide your short introduction.
My name is Razel Ashraf, Ashraf Foundation Assistant Director. Thank you.
Thank you. Please.
Asim Dio, yeah, CBM.
I think he is not in line. He is marking as close.
No, he's
Mr.
here.
Asim. Okay. Mr.
Hello.
Asim CM, do you hear to me? Hello.
Yes, yeah, I
Mr.
can hear you.
Rashid.
Can you hear me? Hello.
Okay, yes, I can hear you. Please provide your short introduction.
Okay, thank you so much. Good afternoon, everyone. My name is Oshim Dio. I'm working with the CBM Bangladesh Country Office as Advocacy and Communication Manager. And at the same time, I'm also playing the role of safeguarding focal person. Yeah, thank you.
Thank you very much, Mr. Ashim Dio. I would like to provide short introduction of Khairul Al-Mamun. Mr. Mamun, please provide your short introduction.
Go for next.
Okay. Ms. Ika, do you hear to me?
Yes, I can hear you.
Please provide.
I don't know
please
if you can
introduce
see
yourself.
me. Sure. Hi, everyone. My name is Ike van Lammeren. I work for the Liliane Foundation in the Netherlands as a program manager and organizational development advisor. And at the same time, I'm also leading the implementation project on child protection.
Thank you, Ms. Ika. Thank you.
Then
Mr.
go for
Masumullah
Jamal.
Shadhin.
No, go for Jamal. Make it short because we are out of time.
Yes. Mr. Jamal, please introduce yourself shortly.
Hi, this is Jamal from DRR. I'm working as a thematic team leader, health rehabilitation and inclusion. Nice to see all of you here. Good afternoon. Thank you.
Jamal, can you update me? Are there our colleague from Cameroon can join or still they're struggling?
She is struggling. I'm sending her the link and password, everything. I'm in the Skype. I'm trying to connect her. So I'm talking with her. I think she will join within 5 minutes. I'm trying to connect
so
her.
after
I'm
joining,
in
we will.
talking.
Okay. So next.
Yeah.
Muhammad Sirajul Islam, do you hear to me? Muhammad Sirajul Islam? I think he's right.
Okay.
Go
for
next.
I'm
Please introduce.
I'm Islam, Disability Inclusion Facilitator, Shamata Project, DRR Shatkir area. Okay, thank you very much.
Thank you, Mr. Sirajul Islam. Devesda, please introduce yourself. Devesda, do you hear to me?
He's not here. You go for the next.
Okay. Rita Tasnim Appa, please introduce yourself.
Good afternoon, everyone. Myself, Rita Tasnim Hussain, and I'm working as a communication officer in DRRA. It's been about 15 months. Thank you for inviting me here.
Thank you. Dear Shahnaz Parveen Appa, do you hear to me? If you, please introduce yourself.
Hi, good afternoon. This is Shahnaz, and I'm working with DRRA as a project team leader. Thank you all. Yeah.
Thank you. Ms. Sarmin Appa, do you hear to me?
Good afternoon, Uncle. I can hear you. Thank you. I'm Sharmin Khan. Currently I'm working as the legal consultant with International Center for Not-for-Profit Law, but my background as a child protection focal point for a long time. I have background. That's why I'm here. I'll just say something. Thank you for the invitation, and I'm happy to participate. Thanks.
Thank you very much, Sharmin Appa. Is there anyone who did not provide his introduction? I think Appa, everyone provided their introduction.
Okay, still Alam Bhai couldn't really connected with us, and also the Flora. So those who are really do their invitation and they are facing problem with linkage, we'll bring them together so we can start in our discussion. So firstly, I'm requesting Sharmin Appa to start your presentation first.
Oh, okay. Because I was supposed to be the last one. Okay, sure.
How about last one, the first one?
No, because I was going to the agenda. So, okay, just give me one second.
Actually, first one is Alam Bhai. So still Alam Bhai is struggling. So when he will join, he needs some time to familiar with these things. So, so if it is not problem for you, you can.
Just give me a second because I was going to like write down all the.
Okay, sure.
Just give me a second, sure.
Sure.
Okay, I'll just do it like this. Thank you for giving me the opportunity.
Sharminapa, I am just interrupting. If possible, you can open your video so that we can all see you. If possible, it is not mandatory.
No, that's fine. That's fine, sure. Better now? Yes, okay. So, as I said, thank you for giving me the opportunity. I currently am working as a freelance consultant with International Center for Not-for-Profit Law. With International Center for Not-for-Profit Law, we actually like monitor freedom trackers of not-for-profit organizations all over the country. So this is what we are doing like really strongly during this COVID pandemic situation. As for child protection issues, as I said, like I was working in the development field for a long time, and I was the child protection focal point with Handicap International, currently Humanitarian Inclusion, for a long time. So why we have a child protection policy? I believe all the organization, local, national, and international organization, it's mandatory now to have a child protection policy. The need to protect children is an issue for all communities. Children across the world are subjected to exploitation and abuse and experience sexual, physical, and psychological violation. Mostly underprivileged children, like most of the children in Bangladesh, I would say. In the time of lockdown that has resulted the global pandemic of COVID-19, billions of people are staying at their shelter. I won't say house because there are many homeless also. So that's why I'm using the term shelter. And without any doubt, this is certainly a protective measure to fight against the deadly disease. So the most vulnerable groups referred to marginalized people of the community are one of them are like people with disabilities. However, I'm putting emphasis mostly on the women, children, and people, other people with disabilities, but like women and children. Study says these people are most vulnerable and they're always victim of violence. Especially in the rural areas, women, children, and other people with disabilities are extreme victim of overall sufferings. In this closed-door situation, these groups of people are at high risk of violence of any form. First of all, service discrepancy will make the situation worsen. It's making the situation worsen in responding to COVID-19. We all know even before the COVID-19 violence of all forms prevailed and those vulnerable people had to suffer a lot. COVID-19 has already caused major economic crisis. So in terms of livelihood, parents might, it's actually the data says like parents are sending their children for livelihood activities. In Bangladesh, I believe all of you know there are. I'm sorry, can you hear? Sorry, is it okay?
Yes, we can hear to you. It's totally okay.
It's fine, Afa, continue.
Okay, like children working as house support are increasing, especially street children, children living in the slum areas because they're for the economic activity. Parents are sending them for livelihood activities as a house support in different places. Street children, there's no opportunity. I was reading in an newspaper article, like street children, they don't know who were actually depending on their what do I say, depending on their earnings from the street, they are actually like they're in a like stealth situation and they don't know what to do. And in Bangladesh, I would say like there is no support to them. The ongoing shutdown due to the pandemic has impeded the livelihoods of these street children. Sorry, Jamal, there's no slide actually. I'm just like, there is no slide.
No, it's okay, Appa. You can tell.
No. I just got a text. That's what I'm saying. So these children, they're remaining outside of government relief operations. The children are also more exposed to the virus as they go out every morning to collect rubbish. Still, they're doing it. Now, if we talk about children with disabilities, the first thing I would say, like the service disruption of these children with disabilities is the major thing. I wish Alum Bhai was here. Alum Bhai could have explained it much better because I was in a webinar with him and he was saying how it's affecting people with disabilities and children with disabilities because the government support for the COVID-19 is not actually reaching to people with disabilities because there is another stipend for the people with disabilities. That's why they are kept outside of this pandemic stipend. I wish like maybe Alum Bhai can join later and he can explain it to you in a like actual what's happening. He can give you the actual scenario. So these are the major things. Other than that, in the urban areas also, like I believe we all have children and children are at risk, and we suppose like the schools are closed, children are all going for online schooling. They're exposed to online it's really hard to monitor them online what they're doing because we are all busy working from home. That doesn't actually give us the scope to constantly monitor our children. Like for example, like when my child is having their schooling, having her school online, she's exposed to anything online sexual exposure, like bullying, everything is possible. So these are the current risk, and I know like you're all you are involved. I'm not sure if UNICEF or Save the Children joined us, but there are some recommendations through International Disability Alliance, and which may I ask you, like you're all following the recommendations, right? Like 10 recommendations. Or do you want me to share? I can share this at least. And this is how like organizations can monitor and can actually come up with a strategy of their support during this COVID-19 pandemic. Should I like share or?
Alum Bhai may join now.
Please, yeah, Alum Bhai is joined. It's everybody can say, but please continue.
Okay. Now I was just saying like so there is a like recommendation like International Disability Alliance 10 recommendations, and we are actually for my channel also we are requesting like to come up with special like what do you call that special recommendation and strategy for child protection, special child protection policy during this pandemic. And I was asking if I should share the recommendations. So should I?
Sorry, I'm late.
No, bhai, you are not late. So your presentation is after Sharmin Appa, so you can take some time and later we finish from Appa. Yeah.
So as I was saying, Alum Bhai, I remember like in another webinar, in another roundtable, because I was saying the government support stipend for the pandemic is actually not reaching the people with disabilities. Right. Because they're getting the disability stipend. That's why they are not getting the actual government stipend for the pandemic. Is it right?
Yeah, right.
Right. So maybe when you talk, you can explain it in a better way. So other than that, for child protection, especially, it's of course children are vulnerable, as I was saying. But when we talk about children with disabilities, like organizations should have come with special messages for children, special cautionary for children, like what children should do. Children with disabilities, I was just reading a WHO report, like 80% of immunization is less this year due to the pandemic. So children are not getting properly immunized. So this is a part of their health risk. Then just today, I'm not sure, like maybe because I don't work with an organization directly right now, I don't know. Children who are using accessibility devices, which are more prone to carry the infection, like wheelchair, other devices. I don't know, like how they can sanitize. This is a health risk. Maybe FOIDAPA or other who are working directly can have more can give us more better picture. So this is it. And as I said, like ICNL, we monitor over globally what the organizations are doing, what the government is doing, and for sure, no government can use this constrained lockdown situation for controlling. So this is the main thing. Like government cannot use this situation as a control measure. That is it. And actually, what I wanted to do, I wanted to hear everyone, and that's why I was supposed to be the last panelist. Like I wanted to hear everyone, then share my.
Okay, so, we will bring second round with you because we keep our panelists very selective, so we can come back again. So thank you, Shaminappa.
It's a pleasure. Nice. Thank you for giving me the opportunity.
Okay, thank you. Before I start the hearing from Alam Bhai, I'd like to give some very quick information. As that we have some quite few international guests from Africa, from Europe, those who are directly working the ground or implementing the project or the policy level working. So that's why we are talking in English. But if it is necessary, we can, it's free to speak in Bangla. So our team is there, they will support for translation. So I share a few data before I hand over the Alam Bhai for his presentation. In May 31st, there was a rapid impact assessment survey we did with the World Vision. And we was their disability technical partner. So I am giving 5 data so you can understand why this workshop is very much necessary, and without Alam Bhai it cannot be give the real data because all we are very academic, but he is the activist. He is one of the leading activists in the Bangladesh and in the international level. 80% children with at home are unhappy during unlocked situation, and they are getting difficulties emotionally or psychologically. This is one you can see. Then 40% of the children maximum in getting meal only 2 per day. That means they off their 1 meal. So they usually take 3 meal, but now they are getting 2 meal or 1 meal, that is 40%. 81% with disabilities are claim that their income reduced more than 65%. 34% household claim that their safe water and safe drinking water is not secured. House hand wash is not even thinking for that. And 94.7% household claim that they have inadequate supply for food no more than 1 month, those who are really under this needs assessment. So we know as a development worker that there is a lot of limitation by the government, lot of limitation for the society, but we are working for the children with disabilities. If it is the mainstream is a cross-cutting rapid situation, then we can easily understand what is the situation of the children with disabilities or youngsters with disabilities. From DRRA, we did a small research during this pandemic period. Sometimes we will share our presentation, but now I'm requesting my elder brother, my beloved Alam Bhai, please share your experience. Khandaka Johar Alam, founder CSID and a very prominent leader on the disability movement. Thank you, Alam Bhai, for your availability with us.
Thank you, Sheila, for the upper. I cannot really forget the 20 years back when I called you.
Exactly.
Yeah, so that's why I'm just said the Sheila, but I should say.
Actually, that is my nickname. So he always called me with my nickname. So everybody now know my nickname.
Yeah, thank you. Yeah. Actually, I was trying before 10 minutes of 3 p.m. but unfortunately I could not connect. But my son, he helped me to connect it. Thank you for inviting me. Actually, my subject was inclusion in the community and protection. Is it not?
Yes.
I'm a little bit confused at this moment because I was struggling a lot. So actually, CSID is working in the community. Basically, it's a community-based organization. Also, we have huge research on disability, and recently, ICT is one of our priority. So, protection is one of our activities which we are working with the UNICEF last 2 years, and we are working in Dhaka, Borishal, and Bola. And our experience, that's absolutely a protection project, protection related project for the children with disabilities. So what I wanted to say that very few people has understanding about the protection, because everybody wants to say rights issue and discrimination issue, not the protection issue. So protection issue is little bit neglected in Bangladesh and not well understood by the government and the even the some development workers. So that's not the issue. Issue is that in this pandemic COVID-19, but I always say Corona because the children with disabilities and persons with disabilities mostly they understand Corona. They cannot understand the COVID-19. So I will say Corona. When we started in the community during this pandemic, we find that especially I will talk about the slum and the rural area. I'm not talking about the people who are rich and living in the high society. You know that we are not working for them. So I find that there is a big problem with the children with disabilities that they don't have any information about Corona. What to do, how to survive, how to take care of health. And not only the children, their parents are also not aware of it because most of them are very busy to collect food from the government side or the local government or from the personal or individuals. So the children are not even getting information what is happening around the world and in Bangladesh. So that has given them a huge mental pressure and mental illness because they cannot understand. Cause is that they don't have television or they don't have Facebook, online facilities, and they are not getting food also. So we started working in Dhaka city in some areas, particular areas. So we find that nobody is going there. Even they are at home and staying at home without any support. So we try to give them support. And first, the very interesting thing was that I will not mention the that organization's name because they did not they asked me not to say the name, but the staffs of that multinational organization, it's not a international organization. The staffs they started giving some food support to the children with disabilities. That was really fantastic. They become cheered up. then we collected for them the sensitizer and the how to wash hand and other issue. But problem is that when we started working in the community, we find that many children don't have their hand even. So how to wash it? So who can support them? The parents can support them, but parents are not at home. They are outside for collecting their livelihood or collecting food for the family. So the children, they cannot some of them of the children most cannot see the television because they are not they don't have television. Even they have a television, they are some are there was no sign language interpreter in the news initially. So there was a huge mental problem of the children with disabilities all the times. Then another problem I could find that the policy of the government and the laws of the government. We have a very nice law which Farida was totally involved with the whole process with us. In the Article 31, if you see that there is a column that if a person with disabilities don't have a identity card, he or she will not receive any support from the government. So that's really makes big barrier for them to get support from the government. I could manage some support from the government in particular areas, but they said that you have to show the ID cards. So most of the children was deprived. They could not receive the food. That was one problem from our side. And another problem started recently. I don't have enough time. I know that I will hear the others. Started the education of the children. Unfortunately, we could admitted all of the children in that project area. I'm talking about a particular project area in Kamrangichor, which is we are operating in support of UNICEF. So they were in the school, but they cannot go to the school. They don't have any recreation. They don't have any health support. That one child, he was attacked by the corona, but even the Dhaka Medical College, Bangabandhu Medical Vishwavidyalaya, nobody admitted him, and then finally we admitted him in a private medical college, but he was died. But even after died, the local authority, the community people did not ask. They give pressure the family not to disclose that he was attacked by the corona. So this is the situation. And another situation is the abuse by the sometimes by the family members, sometimes by the community people. Even that was totally that was never disclosed because the guardians were not ready to disclose it. So we had lot of struggle with the family, especially with the parents, that please disclose it, how they suffer of abuse, but they never disclose it. But we know at least 8 cases in different areas, especially in Sylhet and Borishal. So children are, I'm really, I lost my points of which I wanted to say. The children are not getting really proper care from the government, from the family, from the community, and from the local government. This is the main issue. And the law has also protected them to get the services because they don't have, most of them don't have the identity card. You know, our percentage of persons with disabilities is more than 10%. But government has identified less than 2%. They are giving all this support, only this 2%, not the all. So they are not getting all this support. So we have another problem now. The government has started online education, but you see the children with disabilities who are living in the slum or in the rural area they don't have an Android telephone, so they cannot listen or they cannot learn. They are totally out of education, which is their right, basic rights of education. They are always almost denied. And another issue is that the healthcare. They have lost their. Some of them has already assistive devices has broken. Their assistive devices no more with them, and some disabled people don't have their proper health care. When they go to the medical college, nobody cared them. They denied that you may have corona, so don't come here. And unfortunately, Faridapa, you personally maybe know that the government support, which they say one-stop service center under the Ministry of Social Welfare is still closed. Is still closed. So disabled people don't have, children don't have any medical support till now. So I will come again. I think I want to hear a little bit, and I want to say little more, because the beginning I lost almost 48 minutes. I saw that it was 48 minutes. Sorry. Thank you.
Okay. Thank you, Alam Bhai, for your short but very informative sharing. My motive is I will try to give small some findings. It is true, Alam Bhai, there is no disability-specific research, data, communication service till today by the government or by the NGO, because we, DRRA or CSID or CBM, those who are here, all we are doing some cross-cutting discussion, but not really focusing for any service, not focusing for any protection measure, that is health, education, safety net, whatever it is. Even there is what is the support is given by the government for the mainstreaming, that is also not, there is a specific target for the person with disabilities. Right. I'm repeating one of your quote for giving extra emphasis that in Bangladesh, if a person with disabilities or children with disabilities don't have disability ID, if he is a very disabled by showing or by understanding for everyone, but he or she will not eligible to get any support for from the government because of the disability, because to be a disabled identify, its certification is very important. And according to the government survey, only there is 1%, less than 1% are really person with disabilities are identified, so they are the only enlisted person with disabilities. But all we know, those who are working, like our study says, more than 7% are disabilities in our working area because our baseline, similar like other organization also, but they are not identified or diagnosed under the government existing system. What is the system problem? That is the biggest story. We can do another webinar. Alam Bhai always want to bring this issue, and it is very much found basic issue that if we don't identify be a disabled, like you can see my face, you can see the face for Alam Bhai. He is a person with disabilities, physical disability, but his face is not saying that he is disabled. Everybody is saying we are fine. I am wearing glass, he is also wearing glass. So actually identification is very, very important to bring any plan, budget or the safety net, but that is very weak, and also data. And protection issue, I am very much agree with Alam Bhai and Sharmin Appa that protection issue is also a very Western issue in our country. We always use this issue, protection, safeguarding, when we are really talking, but how to embed it in a country policy, practice and program, that is not really still enough strong in policy and practice, at least for the person with disabilities. So actually we are NGO, we always depends on our donor, and for working like this workshop, it is possible, it is not very much monetary engagement, but for doing any issue in the mass people is need a cost involvement, so that is very difficult. One more things I fully agreed, and I also emphasize that the health, mental health, well-being, and also the access of the rehabilitation. Last 4-5 months, children with disabilities are not at all an issue by even us also. We are so much in a panic that what to do, how to do, we don't know. Our CBR workers don't have protection measure, they don't have what is called PPE for going community, because one PPE one day 1,000 taka, it is 10 euro. So ultimately we are not in a position to provide our worker to the PPE, and many people even the contaminated in the community, our people are hospitalized, are close to die. My partners are here, they will speak. So we fully understand, but we feel so helpless. So during this discussion, our motive is that if you, on all of your communication, our partner, local partner, and also the knowledge management, also international community, if you give some advice that we can move in like this way, all we can really consider that issue, because most of we are working for the children. So now I am requesting Wasim Dio to share his presentation. Thank you, Alimbai. We will come the second round for all the speakers.
Okay, thank you.
Wasim Dio.
Thank you, Faridapa. And thank you all for giving me this opportunity. I may share some slides. Is it okay?
Yes, yes, please.
Okay. Please let me know if you can see my screen.
At least I can see, so I believe everybody can see.
I can see. I can see.
Yes.
Asimda, carry on, please.
Yeah, thank you so much. And I believe I will get at least 8 to 10 minutes to talk, and
yes, please.
I will try to wrap up within this time. And in the very beginning of my talk, I would like to seek apology because I don't have that much expertise in terms of protection. So maybe since the very beginning, I demarked the domain I will talk about. It is much more about safeguarding, and I will talk through a few principles and procedures, and definitely considering the COVID-19, how actually we can ensure the safeguarding of our staff, our beneficiaries, our people in the ground who we are working with and for. So this will be the ultimate objective of today's talk. So let's see in which context we are talking about safeguarding and protection now. So at this moment, we all are going through a pandemic, and at the same time, we are facing another shadow pandemic, that is violence against women and girls. And it is evident not only global, but also in the country context. We can see that there are rapid upsurge of violence against women and children. So in this slide, you can see 80% of garment workers in Bangladesh have experienced, which is a study by ActionAid. But on the other hand, in the contrary, Manusher Jonno Foundation very recently published one study where they found that in June itself, around 12,000, more than 12,000 women and girls have been harassed. So this is the context we are living in. So in this context, today, I will try to share with you some of our thoughts, principles and procedures, and what we can do in this COVID-19 context to ensure the highest level of safeguarding safety for our staff, for our beneficiaries, for the people we are working with. So let's see very briefly just the conceptions, what is safeguarding. So it means that the policies, procedures, and practices we employ or deploy in our organization that is not doing any harm to our people who we are working with and for. These people means our beneficiary, our staff, our consultants, our vendors, whoever we are working with. We ensure that we are not doing any harm to anybody. And it also means that we really care whenever something goes wrong, we take care of that according to the procedure. Now, actually who we are safeguarding in our work, in our program, in our day-to-day project activities. So definitely children and at the same time adult at risk. So in this discourse of protection, we always tend to talk about child protection and child safeguarding. But nowadays, safeguarding of children and at the same time adult at risk is the high topic to talk about, and I believe it is very important for this current context. And when we talk about adult at risk, we believe that in any given context, any person can be vulnerable or at risk, particularly when anything, any decision requires some dependence or requires support from others, or any decision or next step of any activity or work is dependent on other activities. So whenever there are power relationship, there are some vulnerability and at risk. So this is where we should be thinking very rationally in this COVID-19 context, how we are behaving in the field, how our staffs are working from the home, how those power relationships are working, how we are delivering our programs so that we are not pushing our staffs to the risk when they are delivering the project deliverables. So this is where I actually want to draw your kind attention. And as I mentioned in the very beginning of my talk, that there are very specific distinction between safeguarding and protection. Then what are these? So safeguarding, we are talking about what are under our control, where we can assess the risks and place some mitigation measures, how our staff will behave, how the programs can be designed and implementation can be carried out in the field, particularly in this COVID crisis. So this is much more about safeguarding, and protection is about external something which is out there, which is happening, but not really we have any direct control to reduce or something like that. But we can definitely advocate, we can definitely raise our voice to the relevant authorities, but I believe we have very minimum to reduce the protection. Mainly we have something to do with the safeguarding. This is how the focus is. So now I want to go to this slides. Let's see, what are we safeguarding children and adults at risk from, particularly in this COVID-19 context. So there are some abuses. There are many types of abuses. Mainly we are protecting our beneficiaries, children, women, our staff, our consultant, vice versa. So we are protecting them from any kind of abuse, be it emotional, be it physical, negligence, sexual abuse, violence, so any form of violence. So we ensure that we don't do these things to our people. I won't go to the detail as I have very limited time. So, but now how actually organizations can safeguard. So we know what we are safeguarding from. Now how we can safeguard. Then there are some principles we need to adhere to, and these are derived from various instruments you are familiar with. I'm just reiterating here, like the best interest of child, respect for view of child, these things, and mainly the do no harm. So in our projects, activities, we plan and map out to the extent it is possible that we are not doing any harm. And also we are abiding by the principles set out in the CRPD when we are talking about persons with disabilities. So this is very important that our activities are adhering to these principles. And also we implement 4 safeguarding standards, that is policy. We believe many organizations, we now try to establish policy, and we also try to ensure that people are there, particularly focal person. We assign focal person with very specific responsibilities. We also deploy procedures like the reporting mechanism, how to report, where to report, and how we investigate, and how we communicate the results to the survivors. So this is how we can ensure that we are placing the instruments in our organization to safeguard. Now, in the COVID-19 situation, what is the impact of COVID on the safeguarding? The risk factors. As earlier 2 speakers already talked about, I will just touch upon some issues. Like at this moment, we are working from home. So it's a long closure of office, schools. Now we are very closely living in houses or shelters, whatever we say. This is actually posing risk towards safeguarding. How? Being confined in a place for a long time, actually, it is pushing pressure on our mental health. It is putting pressure on our multiple tasks. Like when we are in home, we are not only dealing with official works, but also household chores. So extra burden, and also for the children, this is a risk factor. Then that hospitalization, illness, those things, actually, we need to think now with new coping mechanism, how to do. We are witnessing the news continuously, the bad news. So how we are coping with all this new developed situation, that is another risk factor. Then loss or restricted access to services, support for children and vulnerable adults. That's already evident from the talk of Alom Bhai. Like this one-stop service center is already stopped for a long time. Where our people will go, the persons with disabilities. So this is another risk factor. So another one is increased psychosocial stress due to experiencing death or illness of parents, family members, isolation, home-based quarantine, then stigma, discrimination of those infected. So there are many risk factors around us at this moment we are facing. Now it is a matter of how we accept those risk factors and cope up and develop a new cope-up mechanism within ourselves. And there are other risk factors. I'm not going through that. I have also mentioned some sources here so that if you want to further reading, you can go for it. Now I would like to shed some light on how we know the risk factors, then how we actually ensure the safeguard. Where I think this is the point where we all are puzzled. I am also puzzled. So we are here to learn together. I think I will share my opinion. You will definitely share your opinion. And here, the main factor is risk assessment. So whatever we do, I say whenever we design the program or project activity, considering the COVID, whether we are considering the risks, whether we are effectively mapping out all the risks and identifying and placing the mitigation measures there. Say we plan for distribution of disinfectant or hygiene kits. are we considering the risks of handing over this alcohol or other chemical materials to these people who may not have proper orientation about the bad effect of those materials or substances? And also, are we mapping out any potential risk for any activity what we are pushing? What kind of risks are lurking there for the frontline staffs? So this is the crucial thing, I would say, risk assessment and also placing the mitigation measures. Then second point we need to do is, I believe we have safeguarding procedure, the case management system, that needs to be reviewed, particularly the stakeholder analysis we need to do. Who are our stakeholders, and scoping the possible direction and the mitigation strategies. Here we need to take more time and review the process, how we worked earlier and how we work now. And also regarding the decision making, in terms of any safeguarding issues, we need to strike the balance between risk assessment and severity of the misconduct. We need to very careful about that, whether we are pushing someone to another level of severity of the stress. So we need to think about that. Then preparation and planning in whole process. We need to consciously plan the activities, where we investigate, how we investigate, and if needed, we need to give some pauses, because we are going through the lockdown situation or mobility restriction. We don't have this luxury of going here and there now. So we need to consider that context. And the last but not the least, conducting remote interviews. So whatever we take the steps, we need to abide by the law of the country, and we need to be creative to use other platforms or means to communicate, to conduct interviews, like using Skype or other things. But in doing that, preparation is key, so that interviewee and interviewers, they know what will be happening in the interview. So we need to record that. For if it is possible, we need to record that, and also definitely we need to ensure the privacy and confidentiality. And I would like to share one checklist, particularly this SIA checklist, where we need to be very clear about the messages, what messages we are passing to the people, staff, the beneficiaries. So, and the second point is safe and accessible pathways to report. Lockdown or COVID crisis is not an excuse. So we need to ensure that the pathway of reporting is safe and accessible for our people. Then also let people know that gender-based violence and safeguarding services are functional. So we are caring about our people, even this within this COVID crisis. We need to disseminate this clear message to our people. Then risks are assessed and mitigated, and reviews the progress bi-weekly. And it is adapted from IASC guideline. So it is available. You can please go and check. And if it is helpful, you can use this. So I would stop here. I think I have spoken enough. I tried my best to share my experience and conception. Now, I definitely would love to have any questions, suggestion, and also would love to learn from you. Thank you.
Thank you, Ashwinda. Your very well organized and informative presentation. Many of our participants are asking me where your presentation is available for sharing. So I believe we can share the presentation to others. So
yes,
you can see
I
this
can
is.
share.
Okay, thank you, Ashwinda. We will try to bring a very short question answer session. So as we are running out of time, so I'm now requesting Saurabh Kumar Pal from DRRA, very short study funding sharing on COVID situation, and then we will go for the presentation with Like. Thank you. Saurabh, please.
Thank you, Ahad, for giving me the floor. I'm just sharing a slide. Hope all of you can see the slide.
We can see. We can see. You can proceed. We can see.
Okay. I'm presenting about situation analysis of children and youth with disabilities during this COVID-19 pandemic in Bangladesh context. Here, I just want to share first about the context. What is the context? All we know that WHO declared the outbreak of novel coronavirus disease COVID-19 to be pandemic in March 11, 2020. In Bangladesh, already about 2 lakh people have been identified and contracted by COVID-19, whereas only about 10 lakh, 9 lakh and 80,000 about sample has been tested. And
if I may.
Hello.
The slide is not seen.
Sorry,
Saurabh,
I
maybe you can
think
share.
slide is not there anymore.
Saurabh, there is no slide. There is no slide.
There is no slide, sure. You did not share the slide. Please share.
Yeah, now we can.
Yes. Okay.
Okay.
Yeah, now you can see. Yeah, that's fine. Dulas, yes.
Okay. I'm repeating again. As we know that WHO already declared COVID-19 and as a pandemic in March 2020. Already about 2 lakh people of Bangladesh identified, although the number of tests is very few, about 9,80,000. But the situation of person with disabilities, there is no data or indicator of person with disabilities collected during this pandemic situation, where how many person with disabilities is affected or how many disabilities is there, or any disaggregated data are not collected or covered by government or any other organization. I want to just share something more about context of person with disability. Having disability does not by itself put them in a higher risk of infection of COVID-19, but they are danger due to discrimination and barriers to information, because information are not accessible. Social services and healthcare, they're according to their health condition. Children with disabilities have faced difficulties in implementing basic hygiene measures to keep the virus at bay. Children with disabilities who contract the virus develop severe case of diseases at its origin existing health condition. On the other hand, children with NDD, neurodevelopment disabilities, remain at serious risk of infection and death of pandemic spread due to their congenital heart and gastrointestinal defect, clinical disease, and hypertension. just want to share the methodology. The data were collected about 294 union or city corporation worth of 27 upazila of 15 program implementation district of Bangladesh. Already collected data around 300 unions of 27 upazilas, where we collected data from 3,500 persons with disabilities. According, these data are collected purposefully and according to the purposive sampling method, where CP and physical disabilities is more, or 32% CP is there for collection of data, and physical disabilities was 34%. What was the impact of COVID-19 we found? We found that around 59% with disabilities unable to access general healthcare, and whereas about 69% said or revealed that they are unable to access the education services, while 38% who are say their emergency medicine is not accessible for them due to the COVID-19 affection, or 50. In addition, 55% said the decreased mental health condition for their children, and 80% of the person with disabilities family said that their income or employment was decreased. On the other hand, 59% unable to fulfill basic necessities. Their food were not purchased, or they are taking 1 or 2 day meals, whereas interesting findings that increased 20% domestic abuse and increased child abuse about 15% due to this COVID-19 situation. We also saw the vulnerability situation by preparing the vulnerability index, whereas we saw that most of the about 54% person with disabilities are in very moderate level of vulnerability, whereas more than 20% people are in very high level vulnerability. Because when we saw that the dependency ratio, more than 80% person with disabilities are dependent on their caregiver. They are not independent. On the other hand, the family income decreased more than 80%, in fact more than 85% person with disabilities family income is less than 10,000 taka per month. Whereas we found the child abuse and their condition is physical abuse, emotional abuse, neglect treatment, sexual exploitation, health condition, decreased economical status of family destroyed. All of this situation was found in our interviews. I just showing that our research in this pandemic situation, COVID-19, we are basically doing several research. We will share within few days this as a publication of this report, COVID-19 time series analysis. We want to share this within few days, time series analysis of some person with disabilities. And then we also report on vulnerability situation with Down syndrome in this COVID-19 pandemic situation. We also prepare a report on vulnerability of children with disabilities in COVID-19 pandemic. In addition, we also collected data to incorporate with the data of government system. Therefore, these are writing in Bangla COVID-19 প্রতিরোধ ও প্রতিক্রিয়ায় গৃহীত পদক্ষেপসমূহ ও বাস্তবায়নের স্বরূপ সমীক্ষা রেজাল্ট, এটাতে আমরা মোর দেন 7,000 ডাটা কালেক্ট করেছি এবং আমরা এখনো এটার কাজ চালিয়ে যাচ্ছে। And lastly, we are preparing these results situation analysis of children and youth with disabilities during COVID-19 pandemic survey in the context of Bangladesh. Thank you, everyone. Thank you.
Thank you, Saurabh. Here I like to bring a very quick few elements to relate with Osimda, then Alam Bhai presentation. We all are talking about that we have to track, we have to support the family, also the within family, outside of the family. We as a service providing organization, we are working in a twin track approach. So protection and safeguard, both we are as a DRRA, we are practicing. If you see this research, we are really doing it as an action research mode. And every week we are collecting online information from our partners, from the individuals. And if you see that this is the lifetime progress, of course negative progress, that person with disabilities, children with disabilities are 80% dependence on the family. So family is affected by the COVID, so they are economically jobless or the incomeless. So children's harassment, psychological, economical or social or education is getting less priority. And what is the World Health Organization and UNICEF is saying that after COVID pandemic, it will be big challenge to jobless people rehabilitation or sometimes to bring the safeguarding in the country. So if it is the forecast and if the present situation with the children with family with disabilities, then you can see that what is the future of the protection or safeguard for the children with disabilities. Abuse, we are talking about it is in a separate report we did. In Bangladesh, 40% child marriage are increased during the COVID situation. Those who are the not belongs with the Bangladesh, I'm telling them in Bangladesh, girl child marriage is very popular because family think it is a very easy way to de-shouldering the girl child responsibility and give them marriage. It's one kind of legal abuse. It's because this family this conjugal life will not continue. It's a very much legal abuse. I'm very sorry to say 3 years, 2 years it will continue and then they will divorce because of the dowry. So, and the same times 80% children with disabilities, they don't have food. They are eating one times or maybe 2 times. They don't have medicine. They don't have safety net. And then we are talking about the psychological and mental health. They don't have basic human rights issues. And not a single international organization, those who are really bilateral donor, like our government, are really thinking it is an issue. Everybody is saying, okay, disabilities, how many people are disabled? We do everything for them. So it is a fashion, they are a fashion that they start fundraising fashion. So that's why first we collect the data, first we do the research and then we invite all of you, see the situation. And I bring Alam Bhai with so many people are in Bangladesh, but everybody manage the people. And this is only the person who always talk from the ground or speak on behalf of the community. So Alam Bhai, you look what you are saying and what is the data is saying, it is same. There is no reverse.
Yeah, it is almost same, and we have collected some data with UNICEF. The report will be published very soon, almost the same data. And there is another problem, Faridapa, I should disclose here. There is a big problem and distance between the rich family and the poor family. The rich family, they are advocating that their children are fine because they can dance. Their children are fine because they can eat well. Their children are fine because they can give good food. But what about the poor family?
Right.
Just opposite.
So Alam Bhai, I will come back. So I will come back to you.
Just one point. Okay, just one point. And another challenges which I am trying to saying in the media last few days, that some people has come up the word of special children, differently able, physically challenged. That has created huge problem for the poor community because they don't understand this word. And when they go to the community, ask for the differently able children, What does it mean? Nothing else, no? So this war should be stopped because our no never allow it. Thank you.
Yeah.
At this moment.
Thank you. Now I'm requesting Like to share as a advisor of child protection with the Liliana Foundation. Liliana is working more than 30 countries. So here, this is the picture in Bangladesh and different. So we will do interactive more, but now it is you can share with us. Like.
Thank you, Farida, and already thanks for all the presentations that have been given so far. They're all very interesting and relevant. So yeah, I would like to touch upon a few things of experience of the Liliana Foundation with regards to child protection and the COVID pandemic. So what we see is that the international COVID pandemic ramps up stress amongst families and households and also in those where children with disabilities live. So we've all been asked to stay home for our own safety and for the safety of others. But in fact, victims of domestic and sexual abuse, including children with disabilities who are often exposed to this, being home is not a safe option for them. So what we've seen is that pressure in households and foster homes where children with disabilities live is rising in these pressuring times. As more people stay home, there's more financial stress, etc., etc. And what is already being said by some of our colleagues here is that the help for children with disabilities in these times are not included in the national system. So therefore, the Liliana Foundation set up several humanitarian aid projects for these COVID times and supported families with children where children with disabilities live in around the 30 countries, mostly in Africa, Asia, and Latin America. So what I've already said is, well, what is already mentioned is that there is not much particular data available on child protection, as data is not disaggregated. But in fact, we expect to cases of domestic and sexual gender-based violence at the moment. Children with disabilities were already 4 times more vulnerable to sexual abuse and 10 times more vulnerable to any violence in general than children without disabilities. So yeah, we can imagine what happens in these corona times. But however, fortunately, we see that our Minister Kaag, is giving more priority to the topic of child protection in her policy papers here in the Netherlands. So that means that Dutch NGOs are forced to strengthen their internal systems and responding mechanisms. So that is a very big thing. So we as the Liliana Foundation are also prioritizing our child protection practices in line with the international standards of keeping children safe, which Asim Dio from CBM already touched upon. So these are standard one is policies, making sure that all organizations that we work with have good policies in place that describes how an organization is committed to preventing harm to children, outlining the steps that must be taken, etc., etc. Second one is people. This is addressing the identification of clear responsibilities and expectations for all staff. The third one is procedures, to make sure that a child-safe environment is created by implementing high-quality safeguarding procedures. And the fourth international standard is accountability, meaning that the regular monitoring and review of an organization is in line with the safeguarding measures. So what I already just said is that the Liliana Foundation has implemented certain COVID projects to protect those families where children with disabilities are living. But also we are currently working closely together with DRA on a child protection project to strengthen prevention initiatives at community level, to establish a stronger response mechanism and also use the lessons learned from this collaboration for further scale up, which is increasingly necessarily important in COVID times, but also in times. What I wanted to share with you. Thank you.
Thank you, Liki, for your quick and very brief about the planning and doing. Yes, when we are talking for the safeguarding and protection, so now COVID situation, first priority for their food and health security, because it's an immediate need. Then we can move with many things. So thank you very much. Now, according to, I don't know, hello. So thank you. So I cannot see, but are there my colleague from Cameroon is available then, because it is her time to presentation.
But she is unfortunately unable to attend. She is trying because she is not used to MS Team. She informed.
Okay. Yeah. So she could not get the connectivity.
Yeah.
So it's okay, no problem. So our first round presentation is there because of the technical problem. One of our presenter cannot do, and also same from the UNICEF Flora. She can listen us, but she cannot really speak. We cannot hear from her, so she will send her a written presentation. So when we are compiled our report, we'll incorporate her feedback in our report, so everybody will share and get these things. So we promise that we will close our session on time. We have a few minutes in our hand. So before recapping, we want to listen from our partner who are really working in the ground. You are full free to speak in Bangla. Please raise your hand or text us that who want to speak first for doing good coordination. So আমি একটু বাংলায় বলছি, আমাদের যারা ফিল্ড পার্টনার আছেন তাদের মধ্যে থেকে আমরা যে বিষয়ে কথা বললাম, আপনারা যদি আপনাদের মাঠের কোনো অভিজ্ঞতা শেয়ার করতে চান তাহলে আপনারা লাইভে চলে আসলে আপনি কথা বলতে পারেন। আমাদের তরফ থেকে রিটা উইল ট্রান্সলেট ফর দ্য আওয়ার ইন্টারন্যাশনাল গেস্ট।
PCC already text.
Okay, so PCC, হ্যাঁ প্লিজ কথা বলেন, আপনি লাইভে চলে এসে কথা বলেন ভাই। জি।
So I would like to share about my field experience last few months. So in the COVID situation, we saw that our children with disabilities is very difficult to stay in home, and beside the social participation is very difficulties for them. And actually we are directly work with them. We find the government facilities did not reach for them. Even when the local government make any list, so those people cannot get the facilities easily. So who are able, they can make their list by the getting support from some peoples, but people with disabilities and their families are very suffering in the last couple of months in the COVID situations. So which Appa said already, they are suffering a lot for the food crisis. It is true that. And when our children or youth with disabilities stay home for a long time, and we know that their parents should go out for some daily income. So in that time, they are very risky in the sexual abuse. For that reason, so they are suffering a lot in their home also. So thank you.
Okay, thank you. Anyone from our partner? Otherwise, I will go for the quick second time, any short brief from our panelist, and then we will close.
আমি একটু বলতে চাচ্ছিলাম আপা, এই ফাউন্ডেশন
প্লিজ বলেন
আপা। আমি বাংলায় বলছি।
ঠিক আছে,
যেটা আমার গত মার্চ থেকে তো আমরা জানেন যে কোভিড-19 সিচুয়েশনে আমরা কাজ করছি। তো আমরা ফ্যামিলিতে আমি যেটা দেখছি সেটা মনে হচ্ছে যে আমি দাদার সাথে একমত যে খাবার নিয়ে সমস্যা হচ্ছে, কিন্তু পাশাপাশি যে আমরা বলছি যে শিশু নির্যাতন বেড়েছে, আসলে এটা আসলেই বেড়েছে। কারণ আমরা জানি যে প্রতিবন্ধী মানুষেরা যারা বাড়িতে আছে, যারা বিশেষ করে বিছানায় আছে, তারা তো নির্দিষ্ট জায়গায় পড়ে আছে, আমি বলবো পড়েই আছে, কিন্তু যারা বুদ্ধি প্রতিবন্ধী বিশেষ করে তাদেরকে কিন্তু বাড়িতে রাখাটা খুব মানে মা বাবার জন্য খুবই টাফ হয়ে যাচ্ছে। তারা তো বাড়ির মধ্যে ভিতরে আসলে থাকতে চায় না। ডাউন সিনড্রোম শিশু বা বুদ্ধি প্রতিবন্ধী শিশু, অটিস্টিক যারা আছে তাদেরকে কোনোভাবেই বাসায় রাখা যায় না। আবার তাদেরকে বোঝানো যাচ্ছে না যে এই সিচুয়েশনে তাদের যে তাদের হাত ধুতে হবে বা মাস্ক ব্যবহার করতে হবে, এগুলা কিন্তু তাদেরকে দিয়ে করানোও যাচ্ছে না। তো বাবা মারও কিন্তু এতটা সময় নেই। একে তো তাদের মানে এখন যেমন পরিস্থিতি যে যারা রিক্সা ভ্যান চালাতো বা অন্যের বাড়িতে কাজ করতো তাদের কিন্তু কাজও নাই। তো খাবার সংগ্রহ নিয়ে তারা এমনিতেই ব্যস্ত, তারপরে এত সময় তাদের হচ্ছে না যে ওই বাচ্চাদের বাসায় ধরে রেখে তাদেরকে মানে নিরাপত্তার বিষয়গুলো ইনশিওর করবে বা তাদের বলবে হাত ধুইয়ে দেবে বা মাস্ক ব্যবহার করাবে। এইসব জায়গা থেকে কিন্তু তারা সেই সেবাটাও পাচ্ছে না। আবার যখনই কাজের জন্য বাইরে যাচ্ছে বা খাবারের জন্য বাইরে যাচ্ছে তাকে কিন্তু ওই সময়টাও দিতে পারছে না। তখন কিন্তু বাচ্চাকে অলরেডি তারা বলছে এক কথা একবার থেকে দুইবার বলে দেখাচ্ছে মারছে বাচ্চাকে। তো এই সিচুয়েশনে কিন্তু শিশু নির্যাতন আসলে অনেক বেড়ে গেছে। ধন্যবাদ আপা।
I just give a quick translation. It's the same things what we had presentation. She mentioned that based on the field, the child abuse is more than before, and also food crisis and emergency medicine, like you already know, for the epilepsy and for the other health related issue, they need continuation medicine support, but medicine supply is not available because our workers sometimes cannot visit to the home on a regular basis, and sometimes shops are closed, and also some families are not really supplied the medicine by us. So it's really additional health challenge, and which can really create secondary health related problem. If we can hear from our health professional, they can speak more about that, but today is our issue is the health protection. That's why we cannot go, because when you are stopping the health and rehabilitation service for more than 3, 4, 5, 6 months, so secondary deformity and disability can be increased, and we need, maybe we have to restart for many cases. So anyway, so there is a request from Bina. Can you really share your experience to us?
Yes, please. Namaste. This is Beena from Nepal. Nice to meet to all of you.
Nice to meet you. Please.
Yeah, we are working in Nepal with the organization named Kopila Nepal. Since last 20 years, we are working on the issues of children, women, and people with mental health problems, psychosocial well-being. And I just would like to come to the COVID-19 situation after the lockdown in Nepal. Since last 5 months, we are in lockdown. And during this time, we did lots for the community regarding to the relief materials, supporting for them regular mental health treatment, and telecounseling, and linking them to the government resources, and so many other things we did. And during this time, what we learned from our work is that it is very much challenging to help to the children and people with the disability, especially the physical disabled people with blindness, and then even to the people with autism. It is very challenging for the parents to manage them. And protection of the children is the big issue in Nepal. You know that during this time, we also run a safe shelter for the women and people with mental health problem. And we found that during this lockdown time, we got 6 cases of rape, the young under 18 girls, and all of them are raped by their close relatives. Some of them even parents and maternal uncle and so on. So it is how we can protect them, that is big challenge for us. And the other challenge is that helping them to provide medication and helping them to protect is very much big challenge. And during this time, what we found, as the children are living at home and the family member are living at home, mother has double burden. looking after, and because of her burden, and then I mean that yeah, there are so many male people, and but I don't hesitate to speak it, that the male member don't do anything at home. They are also at home for full time, and then woman has double work, helping them food, cleaning and everything, and at the same time they have more sexual demand from the man, and if woman denied for that, and they are not happy and started having domestic violence. It is big challenge. We are getting more information from our women in the villages, and at the same time the women who have their young kids at home and no identity, like they don't have a citizenship card and birth registration of their children, marriage registration, and these children, these women and children are not getting support from the government in the beginning of the lockdown period. And it was very hard for us to convince to the government. They are their citizen, however they don't have a paper certificate, but they are their citizen, and so we try to convince to the government, and finally they realize and they help somehow for that. But still what we found, the government people who have already bad relationship with some woman. I found a case of woman having disability at home and in severe condition, and she went for the to ask for the relief materials to the government, and government denied to give, and the other people who are better than her got, but she didn't get. And I got lots of information from the community and I support for her. And finally what I found, the man already did abuse to the woman, and woman complained about that, and that's why she was not getting support from the government. I mean that the government structure itself was not sensitive as enough they should have to the woman and people with, and at the same time woman having sexual misbehavior and then domestic violence at home, and woman having more problem to look after the children with disability and people with disability, and that's why the mental health problem are increased, and the suicide and other types of problem are increasing every day. And so I would like to know how to address for those issues in consolidate way. Sorry.
Okay, thank you. Thank you, Bina, for short notice. We get you in our communication, and inshallah we'll keep continue. So here, as I promised in my beginning, that we will make this sharing in more wider level. So it's very common what the Nepal is Bina is sharing from Nepal. From Manushya Junna Foundation did a study. They have similar experience. So if we go for the presentation from the Osim Dio, that safeguarding for the adult, there is a very correlation with that presentation, that actually if we want to protect our children, then we also have to go for the safeguarding for their caregiver and also the family members. So how to do it and how to do it, that is the question. So now I'm going for second round. After all this sharing, all the speakers can speak at least 2 minutes to share their any recommendation, that what is the way forward. Based on that, we will come back again if it is necessary for a consultation for the among all of our study findings or the individual learning, that how we can overcome or face this challenge, what will be the advocacy we can do within country or beyond the border. So that could be a way forward for all of us. So I will start from the Sharmin Appa, who was the first presenter. Sharmin Appa, if you want to share or supplement or any question, you can. You have 2 minutes.
Thank you, Appa. Just listening to everyone, I would say, like, for organizations like service providing organizations, other donor organizations, like, it's not possible to do the organizations by themselves unless, like, we have some kind of policies or government, like we get government support. So whoever like I know like service providing organizations, you're also doing advocacy. So we should ensure governments must support global and regional institutions and mechanisms for the international humanitarian system for supporting during this pandemic, pandemic guidance and measures. Then one thing I recognize, like authorities, especially our local authorities and who are like authorities, like any kind of authorities must recognize that during this COVID-19, the impact on girls, boys, women, and men are all different. This should be acknowledged. Like it's not like support shouldn't be the same for, like you were talking about, how it's like different for children with disabilities or people with disabilities and local. Then of course, like ensuring engagement of communities, like for safeguarding, protection, whatever we say, we should involve and engage the communities. Then I would say rigorous protection and safeguarding of all children, girls, women. We should come up with a strategy and policy. It's through like similar organization network from girls and women from gender-based violence. Then of course, like gender data should be made available, analyzed and actionable. As Lik was saying, like there's not enough data. This is all I can say. Like this is what I've summarized, like I would recommend.
Okay, thank you.
Thank you so much.
Thank you, Sharmin Appa. Now we want to hear from Alam Bhai.
Thank you. Actually, I will go in other way because Sharmin Appa has really mentioned the top things. My first request and first step we should have to change the policy and laws of the government, which is protecting the persons with disabilities to get the opportunities and support from the government. And only Ministry of Social Welfare cannot do anything, but they want to do everything. That's the biggest problem at this moment. There should be the inclusive approach. Second one is the international community, international donors. They are still saying we are going to support the persons with disabilities, and you know, some of us have very bad experience. We are preparing 11 times, 12 times budgets, but there is no allocation. That should be stopped. If they can do it, they should do it. If they cannot do it, no problem. We will go for other sources. Money is available. I never believe that money is not available. Third one is the some big tycoons, big NGOs. They are saying we are supporting the disabled people in the community. This area we have supported 500, but we could not find 5 people even. That should be stopped, because this kind of saying always create negative impact on the persons with disabilities, especially the children with disabilities. We are sometimes giving food, of course we are giving food, but nutrition is one of the biggest problems. That should be stopped. Supply anyway. We should make it available. Fortunately, UNICEF, when they are funding, they are giving all this support: sanitation, sensitization, sensitizer, food, nutrition. That's all. But all should keep in mind that children need much more nutrition at this moment. And finally, I will stop with saying this word, that I am really afraid with some guardians or the activists who are in the who are elite group. They're saying, when they're saying our differently able children, physically challenged children, this really create big problem. But when we drafted and we finalized the UNCRPD, for the you know very well, we were very much present there, and we said it will be persons with disabilities. I am a person and I have disabilities. Why they are making so fun and game, I don't know. That should be stopped, and government should be strict on it. So with all this, I'm really giving thanks to DRRA for organizing this webinar. Unfortunately, I lost 48 minutes. I could not join, but but many times, even yesterday I joined in the Microsoft, so that was not problem for me. Thank you so much, and I'm waiting for the report. And I have a request to Oshimda again to give us his presentation. This is very rich presentation. Thank you so much.
Yeah, thank you, Alim Bhai. So now I'm requesting Shorab, if you have any supplementary information or sharing.
One thing I just want to say, we need evidence-based practice. That's why data collection of personal disabilities and disaggregate data collection is must. Thank you.
Okay, Asimda, are you here? Asimda?
Yes, I am still
yes.
here. Yeah. So as I in the very beginning I said that I'm novice in terms of protection. So the way I see it is to the extent we can control our behavior, control our activities, so we can do to that extent. Like that can be controlled by the safeguarding, placing the measures, correctly assessing the risks, and placing the mitigation measures. So this is how actually we ensure that we are not doing any harm. At the same time, definitely as a social actor, we have the responsibility to do the advocacy with the external actors, particularly government authorities, and what the story and concern we heard from I think I forgot the name, Bina Silwal. So yeah. This concern actually I think same for Bangladesh as well. And I would like to say that we need to work together with the community and the authority. And in this COVID context, I would say this is very crucial. We need to find out a way how we can work together. There is no a silver bullet. I cannot say that something is fit for everything, but I would say that we can explore more the ways of working together, community, civil society organization, and also government authority, how we can bring the changes in the lives of women and persons with disabilities who are really vulnerable at this situation. This is from my end at the at this end of this webinar. I would like to thank DRRA and Faridapa for giving me this opportunity. I'm a very young person, but Faridapa considered me as panelist. This is incredible for me. Thank you, Faridapa.
Thank you, Asim, that you are always like this, and I always told never change yourself. So soft but so powerful your presentation. Thank you. From DRRA group, or also feel if you have anything to share, we can. This is last time to raise your hand. Otherwise, I'm going to conclude with a very quick brief.
Just one thing, I love to, and I really thanks to team from my heart, because they are really very communicative, very communicating. When I could not connect to your team, they were calling me several times, suggesting me, but fortunately, you know, I have IT person at my home, so I call them and they may manage it. I am an old person, I could not do it. Thank you. Thank you.
Yeah,
thank you, Vinadi.
Thank you. Yeah. Thank you, Alamai. Yeah. So very quickly wrap, if we are come up with last discussion with Binadi and also start with our legal perspectives. My understanding is the COVID situation make child and young adult or the person with disabilities protection and safeguarding is more risky, and it's really very fundamental risk they are facing, and it will increase. Our study shows, presentation shows, and field experience also shows. Not only Bangladesh, we try to bring this discussion into beyond the Bangladesh border. Is more international webinar, because we take the message from the Africa and Nepal, and also within Bangladesh with different organization. So this is very proven and practical experience for all of us that it is a common issue that people with disabilities are out of focus and they are suffering more than before. National policy is there, but it is not in practice. NGOs are doing what they can do is limited, but data is an issue, and also budget allocation is an issue. Identification of the disability in early childhood is an issue, and same times parents and family is out of budget. Mothers are overloaded, family conflict are increased, and sometimes legal support and financial support within country, within a system are not really very responsive. So here we believe that we have to work in a twin track approach. We have to do the policy advocacy, but sometimes we also have to do address the issue in the client basis. That means for the family, for the children specific. So this platform we bring all the national and international stakeholders, because to bring a common understanding that this is not an individual problem. How pandemic is a global problem. So protection of the children with disabilities and youth with disabilities is a global problem. So we may need to work together. So thank you very much for my team who are work with that. Yes, there is some technical problem. I'm very much understand, but it's a very time bound program. So in future we will address this issue. Alumni, we are very sorry that we cannot save here for 40 minutes, but in future we'll more careful for that. And but sometimes within 1 week we will share the summary report to all of you with the presentation, and inshallah we'll come back again with our study sharings if we can survive with the COVID pandemic. Thank you very much. Thanks a lot to all of you to stay with us. Be safe. Bye bye.
Thank you to all of you.
Thank you. Bye.
Thank you.
Bye.
Bye, Alumni. Next time 48 minutes beshi bolben.
Thank you, Appa.
Thank you, Appa.
Thank you. Thank you. সবাইকে অনেক ধন্যবাদ, যাদের নাম বলতে পারলাম না সবাইকে।
হ্যাঁ ঠিক আছে, থ্যাংক ইউ।
Thank you, ma'am.
Thank you.